Hello. I'm glad you're here. I wanted to clarify a couple of things about the computer training in the crew rooms. We're doing mandatory in-service training on the computers in the office, in the crew room. These will often include hands-on components. Anytime that there's hands-on, the mannequins and the equipment are going to be stored right by the computers. Also, we're going to keep headphones there for each computer. That way it's easier to do the training when Jerry Springer is on the TV in the crew room. No new equipment is going to be going on the ambulances. No protocol changes are going to occur without mandatory training. Now, I don't want to make the mandatory training a pain in the butt. That's why we're going to make it available 24 hours a day, 7 days a week on the computer. We're going to make it short, sweet, clear, and concise. So you get the information that you need and you don't have to waste your time. Also, wherever it's necessary, we're also going to have live training. So we're still going to have classes where you can ask questions, interact, anytime that we need a little bit larger venue. We're going to have live training classes still available. All mandatory training is going to be worth either CME 1 or CME 2 credit, or depending on the class, it'll be worth both. You're not going to do any kind of training and not get CME credit for it. We're making changes to the video programs as we learn and as we do more of them. The quizzes are getting better, the videos are getting better, not this one, but future ones will. Also, I'm doing away with multiple training programs on the same topic at the same time. I was trying to make it easier so that we could get more CME 1 and CME 2 credit, so I was doing CME 1 and CME 2 programs on the same topic, but it was much more confusing for you, and when you handed it in, it was a lot more confusing for me. So from now on, we're just going to do one training program for each topic, and it will be worth CME 1 or CME 2 or both, but there's not going to be any more, you did the training, but you did it out of the wrong book, so you're not going to get credit. Also, CME 1 training in each required category is going to be on each computer. In other words, we're not going to have the MEDIC refreshers or National Registry refreshers anymore at the end of the year, because we're not going to need them. You're going to have that training available at all times on the computer. Now, this year it's going to take me a little bit longer to get up to speed and to put the training programs on the computer, so they're not all available yet, but training programs in each mandatory category for you to maintain your medical control will be on the computer by the end of the year. Again, and this is important, there's not going to be a refresher at the end of the year for paramedics or EMT intermediates because it won't be necessary. All the training that you need in each required category is going to be on the computer. Which brings me to my next point. We're going to try and make these videos also available on the web. We've got the PDMate video available so far, and you can access it anywhere. And you can also print out the materials that you need to take the quiz and to follow along with the video right off the web. The web address is the DHCA EMS employee website, named, ironically enough, www.dhcaems.org. All you have to do is go to that website, go to in-service training, and you're going to have your in-service training available right there on the website. We don't have all of the videos up yet because I'm still working on it, and I want to make sure that we get all the rest of the mandatory training available for you, at least on the computers in the crew room, before we start changing things around. Again, as I get better at producing the videos, we're going to hopefully have guest lectures, little improvements in the quizzes, and really any suggestions that you have to make would be wonderful. As always, we welcome any kind of comments or feedback. I already have a number of suggestions for different topics that we're going to try and make sure that we produce by the end of the year. We already have a number of different things that we're working on, but again, anything that you see out there, new equipment, new techniques, new protocols, changes to things, let me know and I'll do my best to get them implemented and to produce the training on it. because I don't feel that it's appropriate for us to have new equipment and new techniques and only discover that these are tools available to us in our toolbox when we're on scene in the middle of a call, unzipping a bag, and have some new piece of equipment fall out that we have to figure out how to use. I want to make sure that not only do you have the tools that you need to do your job, but also that you know how to use it. Our goal is to make sure that you get quality training that you need for the patients and the CME credit that you need to stay certified. As always, if you have any questions or feedback about the training or suggestions for CMEs, please let me know. Thanks, and I'll see you later.
No!